Welcome back to the second part of our show on Preserve Health Talks with Dr. Luis Velazquez. And now we're going to change our topic to a little bit of a more sensitive topic and something that has caused a lot of controversy in society today, transgenderism, for a lack of a better term. We want to talk about some of the controversies behind it, a little bit about the history behind it, and where it's going, some of the trends in the transgender community. So in recent years, there's been discussion about gender identity in America. But this isn't new. According to a 2022 Pew Research Center survey, 1.6% of U.S. adults identify as transgender or non-binary, and nearly 5% of adults under 30. So it's definitely something that our younger community thinks about more often. And surveys also suggest about a third identify as trans women, meaning male to female. A third identify as trans men, female to male, and the rest non-binary, or perhaps using the term gender fluid. This isn't new. There are ancient roots of transgenderism and a transgender community. Gender variance has been noted in many cultures. Two-spirit in Native American Indian tribes, Hira in South Asia, and in the early 20th century, when we started writing things down more, Magnus Hirschfeld in Germany advocated for transgender rights as early as the 1920s. The first modern transgender surgery was actually done in 1930. Lily Elby was the person. And one U.S. milestone, Christine Jorgensen, and I think if you're old enough, like myself, you might remember that name, was the first case, and that was as far back as 1952. So my lead-in questions are to you, Dr. Velazquez. Surveys show more people identifying as transgender today, especially youth, 5%. Do you see this as a true increase or more openness and perhaps in certain communities, and not all, social acceptance?
I would like to start by first making a statement about respect and dignity. This is a very loaded, charged conversation, and I certainly don't want any viewers to think that we have any bias or animus towards any sexual identity or lifestyle. I absolutely support anyone pursuing the path that makes their life happy and complete, whatever that is. I simply want to review some of these numbers because they merit attention. And being supportive and accepting of people doesn't mean that we don't look at the science objectively. And we should always put science and math above public policy. First we need to describe what's actually happening scientifically, mathematically, before we can start conjecturing as to how to make life better for people. Let me review some of the numbers that I have, and I'm referencing the Diagnostic Statistical Manual for Mental Disorders, DSM, 5th edition, the most recent, if you will, science by committee document put out by the American Psychiatric Association that gives definitions and diagnostic criteria to psychiatric illnesses. According to the DSM, 0.005 to 0.014% of youth born male wish to become female, and 0.002 to 0.003% of youth born female wish to be male. And this was historically 2.5 times to 4.5 times as many males wanting to be female as females wanting to be male. So it has changed drastically. Overall, the incidence was 1 in 10,000. In the last decade, adolescent gender dysphoria has surged in the West with a 1,000% increase in the US and a 4,000% increase in the UK. And now it's been reversed. 3 out of 4 youth who are transgender are females wanting to be male. And then the rate of medical interventions or surgeries has increased as well. In 2016, 46% of gender reassignment surgeries were female to male. And in 2017, just 1 year later, it increased to 70% of gender reassignment surgeries were female to male. So the world has changed. I mean, these numbers are 3 orders of magnitude. That is not likely to be scientifically possible. So what else can explain the sudden increase? In 2021, the CDC did a study of 98,000 youth in 18 states to ask the question, what is your identity? And about 2.6% identified as transgender, and another 2.9% identified as possibly. So that's a phenomenal increase in the possibility. So how did this happen? And is it okay for it to happen? Well, it's not okay if people begin making changes in their anatomy and their biology with hormones only to regret it later. And there's also the question as, is this the chicken or the egg? Are these individuals simply of an alternate sexual identity or gender identity, or is there something underneath it? Most of these individuals, the great majority, have other problems in addition to being gender dysphoric.
Well, let
Many
me
are
interrupt
anxious
you.
and depressed.
Just 1 second, and
Yeah.
I want to back up 1 step, because we know we have the true male, XY chromosome,
Absolutely.
true female, the XX chromosome, and then we have some variants in there, which like Klinefelter syndrome, syndromes like that, where you have an extra chromosome, but we also, an extra X chromosome, but we also know that from the DSM, that there are also true hermaphrodites that do have male and female
Right.
anatomy, and they have to decide one way or the other. There's a statue in the Louvre of a true hermaphrodite where they have both ovaries and testes. And I would imagine that still exists, although it's a very, very small percentage.
It's a small percentage of those who identify as non-binary.
Correct. But this is the point I'm trying to make. The DSM, which is a diagnostic and statistical manual of psychiatric disorders, is transgenderism a disorder? I mean, if you really believe that you are trapped in the wrong body, is it a disorder? Or because that's how society,
That's a great
mainstream
question.
society views it.
Let's take a
yeah, let's-
macroscopic look at this.
Okay, let's do it.
You know, there's evolution, and nature every now and then throws a curveball to see what happens. You know, there'll be why do we have 2 eyes and not 4? You know, why do some mammals have 6 nipples and some have 2? Because these are just experiments in evolution. Some of them work and some don't. And nature doesn't waste energy.
Aside from the radiation out there.
That's right. That's right.
Okay.
Yeah. So, there are mutations and there are genetic coding errors that result in experiments in nature. Now, to call something a disorder, it has to create a dysfunction. It has to limit your ability to progress on the life course that we can project you would have if you didn't have that problem. And many people can have perfectly fulfilling and happy lives with gender reassignment. The question for today is, why has it increased by 3 orders of magnitude? You know, is it because of something biological, something in the environment that's provoking this, some toxicity or exposure? Or is it something else? Is it a social contagion that might be transmitted through online venues?
And it seems to be regional. In other words, you see more transgenderism in Brooklyn, New York, than you do in what Tom Clancy used to call the flyover states.
Yes.
Iowa and Kansas.
Even between the U.S. and the U.K., why is there a 4 times difference? And then you look at the rest of the world. And yes, there have always been two-spirit people, and there have been people that have great ambivalence about their identity and refer to themselves now as gender neutral or gender fluid. But why the sudden increase? Is it because before we didn't tolerate people and now they feel free to come out and be themselves? There might be some of that, but I think the greater reason to explain this change in the incidence of these identities has more to do with social contagion. And that's why you have more in Brooklyn than you would in the square states.
Well, pronouns are also a major issue, both socially and, of course, politically as well. So from a psychiatric standpoint or view, are they affirmations of identity or just symbolic constructs?
Wow, that's a very long potential conversation there.
It is.
It is, all by itself. I think it's good to show people respect and address them by how they want to be addressed. The problem for me is in language. The language I speak, English, has 2 genders. And when I'm being asked to use plural pronouns for a singular individual, I find it very confusing. And I gotta be honest, I find it to be somewhat of an affront, because you be you and live your life, but do not make demands on the rest of us to reform the language that we've used for centuries. Maybe you're not comfortable using one of the 2 binary pronouns, but we need to do something so that everyone doesn't feel put upon.
Okay. So then there are several drivers, is what we've discussed so far, about what might drive someone to consider themselves transgender, non-binary, so to speak. Biology, psychology, environment, all of the above. Comments?
I think it's environment as transmitted a lot by online venues. I worked in Massachusetts for many years, and there were some communities where greater than half of the youth identified as LGBTQ plus, and that statistically impossible. It's become fashionable in some places, to consider the possibility and not to embrace it as something good, put you on the outs and to be the object of ostracism. So I've seen kids who were ostracized because they didn't identify, or because they had a religious viewpoint which was seen as primitive or in some way biased. It's not irrelevant that so many of recent shooters have been trans or trans adjacent. It's not irrelevant that there are so many Hollywood celebrities who have trans children, almost as a social accoutrement, or this is my living, walking virtue signaling for you to see that I'm so embracing of alternate identities. All these messages reinforce a worldview. And we live in a time when we have competing worldviews and competing value systems. And that's okay. But the fact that we will push back and say, I don't see what you see and I see it differently, that needs to be accepted. We need to have social discourse. The public square belongs to everyone, and we should all be able to discuss these issues amicably.
But at what age, and this is a tough question, at what age, if someone, as a physician,
right,
a family physician who sees
you treat the family
people who say, my son really believes he was born in the wrong body, and he's had that belief all of his life, but at what age should we as physicians, one, start taking this seriously, and two, should we get involved, not get involved? Is there an age there? If someone's 10 years old, I don't think they're fully mentally developed, but if they're 21 years old, they might be better able to make decisions. What type of psychiatric or psychological training or counseling do these individuals need before taking that leap to change their identity sexually?
You know, parents should always love their children's whatever package they come in and with whatever problems they have. That's the definition of a parent. And I don't think parents should ever be removed from the business of guiding their children to a healthy and better future. So at no point do I think that parents should be removed from that while your kids are still under your tutelage. You know, you hear about school systems that don't tell the parents that the kid identified as trans in school and then facilitate that transition socially in school, and then the parents find out about it. That's absolutely horrendous. You know, we cannot disempower the role of parents, assuming that parents are doing all the right things. And we should be open to discussing this. My experience and my bias, and I'll admit that to you, is that I've seen too many mental health care workers be biased on the side of always facilitating transition for youth without questioning, is this really about you being trans or is there something else going on underneath it? You know, and why the rush to medicalize it with hormones or surgery? When probably the great majority will desist and return to their former gender identity eventually. Once you make the medical transition, you're kind of stuck there. You have no choice. Then you have a sunk cost fallacy. You can't argue against it.
True. So here again, it goes back to parenting, the same as with the social media time, the same as with the artificial intelligent chatbots that your child or adolescent might be viewing as a counselor rather than you. So it all goes back to spending time with your kids. That's what I'm hearing.
Spending time and not surrendering your role as parent. You know, but I'll say this, the families are struggling, not just kids, families. And a lot of adults are addicted to their cell phones and to the media. And even when people are home as a family, they're not together. They live in isolation in their own homes. So families have to make a decision to spend less time online and more time in real life. You know, going outside, laughing, telling jokes, and not succumbing to the Borg. You know, being more of the profane and less of the sacred, because you know online life is varied, and you've got to be studious about what kind of online life you have and you allow your kids to have.
So just briefly then, to wrap it up, what guidance do you offer families navigating these complex issues? And how do you do it with compassion and concern for their long-term well-being?
I make it very clear to families, because I treat not just the child but the family they come with, that I have opinions like anybody else, and I have views, and I want them to know those views before they decide to continue with me, because they may decide that I'm the wrong person if I can't be accepting from the moment they step in. And it's not that I'm not accepting, I'm just not necessarily believing. I can accept without believing. I can say, let's look at this, let's see where this goes, and I'll be supportive as I can be ethically along the way. I think that if we agree to accept the individual as this individual wishes to be seen now, but let's look at what are the influences in this child's life that might be contributing to this identity. And by the way, is this individual, this child, also anxious or depressed? Or is this child developing a personality disorder? You know, then we should address that. And this is a dangerous statement here. I've seen clinically that most of the individuals that have early onset gender dysphoria are more likely to be truly trans versus late onset. Some individuals never had any inkling or sense of being transgender until suddenly at age 13 or 14 they discovered they were trans. Those individuals tend to have a lot of what's called identity diffusion and are much more likely to have an underlying personality disorder. And that's where the money is. You want to focus on treating what's causing you to have such an unstable identity. And if you treat the anxiety and the depression and the character structure as you can, you might help this individual. However they choose to identify eventually, at least you've identified the underlying problems that go with that identity diffusion.
Thank you so much for being here today.
Absolutely.
And helping us explore this most sensitive topic.
Absolutely. Thank you
Okay?
so much for having
Thank you.
me. Yeah,
we
yeah.
look forward to seeing you soon, and thank you for joining us for another episode of Preserve Health Talks.